Hello, everyone. My name is Gurja Basra, and I'm the Manager of Patient Programs, Research, and Advocacy here at Lymphoma Canada. And I'm pleased to welcome you all to our 8th annual National Patient Conference on Lymphoma and CLL, taking place virtually over the course of 3 days from October 16th to 18th. At this patient-focused educational conference, you will learn critical information about diagnostics, treatment, side effect management, navigating the healthcare system, and the latest research advances from a number of Canadian lymphoma specialists. As lymphoma continues to impact many Canadians, our mission at Lymphoma Canada is to empower patients and the lymphoma community through education, support, advocacy, and research. Lymphoma Canada is the only national organization dedicated uniquely to supporting the lymphoma community. In this regard, to achieve our mission of support, we offer a wide range of resources, including patient resource manuals that dive into all things diagnostics, treatment modalities, and beyond. We also have subtype fact sheets, a guide on treatment side effects, life beyond lymphoma, and a watch and wait guide. Recently, Lymphoma Canada has also shared a coping with fatigue and end of life care guide on the website. You can access these resources and many more by visiting us at www.lymphoma.ca or on the conference platform under the Resources tab. You will have the option to look through our resources, add them to your virtual swag bag, and send them directly to your email to download or view. So I encourage you to have a look at this over the next coming days. Lymphoma Canada also hosts many support programs, including our peer mentorship program, where patients and caregivers can be matched with somebody further along in their lymphoma journey to receive valuable one-on-one support. For more information on this program, be sure to visit our website. I would also like to take a minute to thank our wonderful presenters for their contributions to the lymphoma community and for taking the time to present at our national conference. I would also like to take a minute to thank our generous sponsors for their support. Thank you to our platinum sponsors, BeiGene and AstraZeneca, for their support. Thank you to our gold sponsors, AbbVie, Johnson & Johnson, and Mallinckrodt Pharmaceuticals. Thank you to our silver sponsors, Bristol Myers Squibb, Pfizer, and Gilead. And thank you to our bronze sponsors, Kyowa Kirin, Roche, and Incyte. Thank you to Ricardati as well for being an additional sponsor partner. With that said, I would like to introduce the chair of this year's conference, Dr. David McDonald. Dr. McDonald is a hematologist at the Ottawa Hospital and assistant professor in the Department of Medicine at the University of Ottawa. He received his MD at Queen's University and did residencies in internal medicine and hematology at Dalhousie University. He then did a clinical trials fellowship at the National Cancer Institute of Canada Clinical Trials Group, then a clinical lymphoma fellowship at the BC Cancer Agency in Vancouver, and he was chair of the hematology cancer site team for Cancer Care Nova Scotia for 10 years before moving to Ottawa in 2017. He's also a member of the Scientific Advisory Board here at Lymphoma Canada. So thank you, Dr. David McDonald, and I will pass it over to you.
Good afternoon. I'm David McDonald, and I'm a hematologist in Ottawa, Ontario. I have a clinical practice that gives me the privilege to look after patients with lymphoma and CLL. My focus is on trying to provide the best possible care to patients with the best possible access to treatments that improve outcomes. I have a strong interest in clinical trials, and I encourage patients to participate in clinical trials whenever possible. And I strive to bring the best trials to Ottawa to make available for my patients. This is actually the 20th year of my practice. The first 13 of those were in Halifax, where I had a wonderful group of patients and coworkers. But 7 years ago, I made the decision to come to Ottawa, where I could be closer to mine and my wife's families. It's truly an honor to chair this year's National Patient Conference on Lymphoma and CLL, hosted by Lymphoma Canada. Over the next few days, you will hear talks from experts from around the country, giving the latest updates in regards to all things lymphoma. Day one will focus on giving a brief introduction, looking at lymphoma in the adolescent and young adult population, as well as giving an interview on targeted therapies. Day 2 will focus on the various subtypes, followed by Q&A sessions, as well as a discussion on side effects management and exciting new therapies on the horizon. The final day will dive into health and wellness in regards to exercise, sleep, and fatigue management for patients. It is also a pleasure to introduce you to this year's patient and caregiver to share their stories. Jose is my patient with Hodgkin lymphoma, and her caregiver, Genevieve, is her sister. And as I think you'll see in their interview, Genevieve really is the giant, the rock in the corner that has been providing the support that Jose has needed. Jose's story is not a unique story. It involves a lot of things that happened to her and around her in the time period before she had her diagnosis of Hodgkin lymphoma, including some very difficult, I think, interactions with the healthcare system. And as I said, I think that this is not an uncommon experience for lymphoma patients and CLL patients. So this is an aspect of patients' care that really is before they meet us as the oncologists that we don't really have a lot of control over. But I think it provides some lessons really for how we can address our colleagues in the emergency departments and in family care to educate them regarding what lymphoma is and what the expected outcomes are for patients with lymphoma. It really has been a roller coaster ride for Jose. And I remember distinctly the day that I met her. She was really quite understandably emotional, and it was clear that her experience to that point had quite a broad or a profound impact on her. How she has taken that experience and turned it around into something positive, I think, really is something that really has been inspirational to me, and that's why I sort of thought of Jose as a good example of a patient who really has something to share with the lymphoma community. I thank Jose and Genevieve for having the courage to share their story with this group. And now, without further ado, I will turn it over to Jose and Genevieve. Thank you, and I'll be seeing you again later on.